thanks so much for joining today, our kind of quarterly, bi-monthly equity and advocacy group meetings. This is part of the Michigan Collaborative Type 2 for Type 2 Diabetes, one of our work groups that focuses on advocacy and health equity. And it was really in response to many members' feedback and general sense that we wanted to provide a space for people from across the collaborative to learn, to share, and to make space for discussion and furthering of our health equity and advocacy kind of interest across the collaborative. So thank you so much for being here. Laria Young is on the call too. She's kind of my co-host and partner in these meetings. Our last session, we focused a lot on our health equity dashboards for MCT2D. And there will be further discussion about kind of data and health equity at our collaborative-wide meeting, which will be in Lansing actually tomorrow. So hope to continue that conversation. But today we're just really excited to take time to highlight the work of one of our Patient Advisory Board members, Larry Davis. I'm just going to do a brief introduction, but for those of you who don't know, MCT2D has a Patient Advisory Board, which is a collection of patients, caregivers, families who are all impacted, in their daily lives by type 2 diabetes. It's been a group that we've had running since the start of the collaborative, and it really is important for us to be able to listen deeply and to have leadership from patients for the collaborative, for things like the resources in our resource library, ensuring that things are really useful and accessible and high quality and up to patient standards, as well as having patient input on strategic direction, and also providing just the space for us to kind of get to know each other and have a deeper understanding of how diabetes issues impact people across the state. So it's been really valuable to have this group. Larry is an esteemed member, as well as Ellen B. Waxman, who's also on the call. There are two patient advisors. We're really lucky to have their involvement on our board. And Larry has been really taking a leadership role in the past couple of years in a program out of Tufts University, but it really is a kind of a national movement. And so we've had the director of policy initiatives from the Food is Medicine Institute at Tufts University, Emily Callahan here. And we're just really excited to be able to hear more from Emily on her work with food legislation, including medically tailored meals, food access, and a variety of topics that are relevant to diabetes and kind of lifestyle change. And so I'm going to just share slides here on behalf of our speakers. And let's see. So there they are. So yes. Great. This was in our newsletter. This was on the Hill, but we're really here today for them to speak to you all. But feel free, there will be time for questions, and feel free to put notes or comments or questions in the chat as we go along. But we're here to let them share the incredible work that they've been doing at the national level to bring folks together around food advocacy. So let me turn it over to Emily and Larry.
Okay. Emily, would you like to get us started?
Sure. I can kick off and give some background context. That was such a kind introduction, Noah. I've been really just blessed to get to know Larry it's been, let's see, Larry, we met in March or April of 2024, so just about a year ago. And it was in my role. I'm the director of policy strategy for the Food is Medicine Institute at Tufts University, and I'm going to put our website in the chat. And so, as you can imagine, the institute being at the university, research is a key focus for us, and many of the personnel associated with our institute, there's about 20 some of us, are academic faculty members generating policy relevant research about food and health, and food as medicine is our specific focus. And when I say food as medicine, we define that as food-based interventions integrated into healthcare. So medically tailored meals, medically tailored groceries, and produce prescriptions are the three interventions that our faculty spend the most time researching. We look at their effects on health outcomes like A1C, blood pressure. It kind of depends on the population we're looking at, what outcomes we're most interested in, but we also look at healthcare utilization outcomes. And so what we have found is that these food as medicine interventions have demonstrated benefits, not just for improving people's health, but for helping lowering healthcare use. And so in some cases, they've been shown to be cost savings in healthcare, which is super impressive. We've found that they're associated with fewer hospital readmissions in certain populations, with fewer emergency department visits in certain populations. So as you know, those things can save the healthcare system money. And as you might also know, the US spends about, I think it's approaching $5 trillion every year in healthcare. And many people in Congress are really concerned about how healthcare spending has gone up so sharply in recent decades. And so they're very interested in hearing about interventions that can improve health and help the country manage healthcare spending. And so that's where food as medicine has caught the interest of so many people in Congress, and not just in Congress, but in the federal government and in the private sector, with private insurers and beyond. And so as we've built up this institute over the past almost 2 years, we've just been adding to the list of activities we do. And so last year we held an advocacy day in April of 2024, and it was so successful we decided to make it an annual thing. And so we just had our second one in March of 2025. And I believe, Larry, we got connected because the director of our institute, he is a cardiologist and a very accomplished nutrition science researcher as well. He had some connections at University of Michigan, and he was in a meeting with some of them, and he mentioned, we're having this advocacy day. We'd love to bring some patients in, because who better to tell about these interventions than the people that are actually partaking in them? And so anyway, long story short, we got connected to Larry, and Larry, it was like 2 weeks notice. You agreed to come to DC, and we met and we spent the day together. And then we did it again this year. And so I'll just pause there after giving what I hope is good context, and let Larry maybe speak to his perspective on that. And then I have some slides recapping our second advocacy day, which was just about a month ago.
Well, thank you, Emily. And thank you all for allowing me this opportunity to speak with you. Yeah, I about three years ago when I was diagnosed with type 2 diabetes, and it kind of came on me all of a sudden. I not so much, but I was I had been told I was pre-diabetic for maybe a couple of years at least. But then I did eventually become develop diabetes, and shortly after, my primary care physician connected me. Well, he brought in our registered dietitian nutritionist to help me, nurse nutritionist to help me, help explain to me what was going on. What that meant, what it is to be what type 2 diabetes is, and what I can do to something to manage it. Because when I initially was when I started having symptoms, I was immediately put on insulin, and just and I was on insulin for a couple of months, as a matter of fact. But I was able to, I guess, at an early point, I was able to not have to be insulin dependent at that point, after a few months of making some adjustments in my diet and what have you. And those adjustments were made with the help of the RDNs like Arena and being able to get a better understanding of it. So at another point, and shortly thereafter, there was what's called the Healthy Jumpstart project, on which the RDN asked me if I would be interested in a project that will provide fresh produce, fresh food, a 3-month for $80 to purchase things that were, that would be that would be diet friendly to me, that were, and that would include, like I said, fresh produce and other things that are diabetic healthy. And for that 3-month period, I was able to get it. I was able to basically, it was a prescription in a sense. So I then provided that, the funds to pay it, and I purchased through Kroger, and then it was the ship delivery brought it to my door. So, medically tailored, and that I think it's continued my path toward being better able to manage my diabetes. So then I was eventually asked to, given that, and I was excited about that. I tried to stay in contact. Really what it was I started to feel, kind of empowered in a sense, and I got more interested in what I could do, as a patient. I didn't feel like, okay, you got, you have diabetes, go figure it out, okay, thanks for letting me know. So that personal connection, and that having, the RDN have, with the knowledge base to tell me, what's going on with my body, why it's happening, and, things that I can do to, to make sure that I was at least maintaining my health as best I could. And it got me going. And then I was eventually asked to participate as a patient advisor on the MCT2D Patient Advisory Board. And then magically, I considered this opportunity to go to Washington, D.C. and participate in the National Advocacy Day on Capitol Hill. It just really, like, kind of blew me away. And when I got there and I realized that, wow, this is a real thing, and it's not just with type 2 diabetics or people with diabetes, any chronic illnesses. And so, I met some amazing people. I met Emily, and Dr. Mozafarian, affectionately known as Dari, he prefers often, and others at the Institute, Cecilia, and we have now Denisha there, and others. So it was, I just to see the whole breadth and scope of the food as medicine effort, if you will. I got to see meet health providers, and others who are in rural and urban areas who are working with local food programs, other patients, of course. So it's just been an eye-opening experience for me. And to go to Capitol Hill and to meet one-on-one with, like, the congressional aides, in the offices, along with, a group who, like just me as a patient, but then the other researchers, doctors, clinicians, what have you. and the insurance companies, for example, they have a big interest in that too. It's extending life and lowering costs. So, this is just been a real eye-opening experience for me. And, I'm just trying to do my best to bring that back home because of now when I engage with like my food pantry, local food pantries and things like that, I share the information about the Food as Medicine, the Tufts Food as Medicine Institute with them. And I share my experience, and then there's some things that are still developing. So, and then on a personal level, it gives people, my family, for example, my grandchildren, they have taken a new look. They've learned quite a bit about, you know, me having type 2 diabetes and why my diet's a certain way, and things and ways in which their diets can be good and healthy. But like I said, it just to see 200 plus people there, you know, going in and out of those congressional offices and seeing that there is interest there, across party lines. And then in this day and age, you know, uh, change, it's going to be even more important that we have, that we expand the efforts we do in terms of, provide equity in food, and being able to deliver, um, treatments for our chronic illnesses. It's going to take another extra level, another effort. But there's all the components are here in this movement I thank Tufts University for being out in the lead of that and letting me be a small part of it.
Thank you so much, Larry. What an incredible testimony. I mean, just hearing, you know, I see it was kind of serendipity that we got connected you all, and it was a 2-week turnaround. But in some ways, you were ready. You had been engaged with Rena, with the dietitian. You were on this track to like turn things around, and hearing about, the being on insulin and then being able to make that switch off. That's so cool. And that you haven't just, it didn't stop at 2 years ago you going to DC. You've like continued to like spread the word and be a leader like in your own community. Like, I mean, what has been the impact of this involvement with Tufts for you?
To me personally, or just to me in general?
Personally.
Personally, it's because on our board, our MCT2D board, patient advisory, there are other patients who are I think, far more knowledgeable about things than I am. But we all come together to share. What the impact of the working with Tufts has had is that, like I said, I see the big picture. You know, um, how things are interconnected. Like I said, there you have insurance companies on one hand, and so on a personal level, that makes me look at my insurer a little differently. It makes me think about, well, what are they offering? Sometimes, we don't, as a patient, there are things that are there available to us and we don't know. There are certain benefits and certain things that are there that we don't know. So, and then there's so, so then there's the research that's going on. And Emily can speak more on that. The different studies of, like GLP-1 use, and other agonists, as they say. I'm trying to sound like I know something. But okay, I have few friends who are diabetic, and they ask me things, and I can talk to them a little bit. I can at least tell them, hey, I can help them find something. but for example, like I have one good friend who he has he's on a GOP now, GOP-1 now, Ozempic, and he's like 79. And he says, wow, man, I've lost, it took about 30 pounds off of me. He says, well, you can't taste his food sometimes, though. But, that's just like on a personal level there. But I was able to talk with him about and reading some of the information I have from Tufts about, it breaks down what those agonists are and what they do. And, and talk to him, and show him some scientific, you know, reasons why those, what the purpose of those medications are and how they work. And he was like, "Oh, okay, I see." But I'm not a physician. Clearly, I wasn't trying to give him any medical advice. Um, but I had no idea what the GLP-1 was or what the agonists were, but I was able to get some of that information in a presentation that Tufts has done on like our community council, which is another thing that Tufts has going. The Food and Medicine Institute has going. It is I'm also part of a community council, which is a broader group of patients or on a more national scope. And like I said, the impact of that, it makes me see that there's a lot of work that can be done. There's a lot more ways I can talk to my local, like my local representatives here, and I can be involved as a patient, on things that will directly affect the services that we may get, the services that are available in my neighborhood, even for that matter, So it's had a big impact, and it's a lot more ahead, to share.
That's wonderful. I mean, it sounds like it's made a big impact on you, but you've made a big impact on it as well. Just the fact that, we're at University of Michigan, we're making similar type of presentations, handouts, but the fact that you could take that information and bring it to somebody else is really what's going to make the difference and reaching other people. So yeah, I appreciate that.
Said no, we have a great group of people. We have a lot of very knowledgeable people on our MCT2D board. Dick and everyone. He's just an encyclopedia of knowledge and good, and he's funny too. So he really helps. When he shares, and he shares what's going on, the latest, you know, um, efforts that are going on, the scientific discoveries, whatever it is. So we have a great board. I'm just a small part of it. Thank you.
Very humble. I had a question saved to pose to both of you. I'll ask you, Larry, now, and I'll ask Emily once she gets to do her presentation. But I think this group is here as the advocacy work group. But I was wondering, what does advocacy mean to you?
Um, it's um, it's reaching people, informing people of things, something that in terms of chronic diseases, of chronic illnesses, I should say, um, making them aware of you know what it is that their health challenges, and keeping them informed where they can get help, how they can go about help getting it, changes that they can, just getting them the information, and then about particular chronic illness, and getting them to get maybe joined up with a support group or have a better conversation uh, with their primary care or whoever's providing the health care. They can be engaged, and my part of it is to try to reach people and so that they can buy into that their own health program, better healthcare program. So I don't know, just speaking on it, just being able to let people know that these are the conversations you can have with your physician. These are the conversations you can have with your nutritionist. If you don't have a nutritionist, here's how you can go get one. If there's something that you don't understand about this medication or something, these are the people to ask. These are the ways you can find out. And there's the services, like I was mentioning, sometimes services benefits that your insurance company offer that you don't know about. Here's a way to find out. Here's, if I may not know, but I can help you try to find an answer, or someone who does know something. So, and just getting word out, because a lot of, like I said, when I was pre-diabetic, I just said, okay, or I'm not diabetic until I was. So, the more that we can just bring awareness, and, just kind of reach out and find people wherever they are, and be able to tailor a message to them. But if I can do that, like, for example, locally, if I can do that at the food truck that's downtown Ypsilanti, Ann Arbor, which is a city in this area here, then I can do, I can reach somebody. I can put it in that way. Some of the larger organizations like food gatherers, they deliver to the local food pantries and whatnot. Hey, I'm telling them about food as medicine, hey, and I'm turning them on to figure of speech. I'm telling them about the MCT2D Collaborative, also Tufts University Food as Medicine Institute. So, yeah, just informing, making people aware, and giving them ways in which to improve their health, and get the just improve their health, I guess.
Great, thank you. That you have a very sophisticated view of advocacy, and I knew that was going to happen. But yeah, we're here under this umbrella term, but I think it can mean different things to different people. And I think we probably have some folks on the call here who are care managers, dietitians, folks from the physician organizations, clinicians. So it's going to be different for every person, but I appreciate you sharing that. I wanted to turn it over to Emily. Um, and let me share slides again, because we really are curious how this all came about, and what happens when you go on the Hill. It's something that we've talked about at this group. Are people aware of what that means and what's involved and what it looks like? So we'd love to know.
Well, thank you. I'm happy to talk a little bit about our advocacy day and how it got started. And I guess one other note of context I can share. I'm a registered dietitian by training myself, and I've really appreciated getting to engage with Larry and other folks on our community council, which he mentioned. It's sort of like a patient advisory group. We just have a different name for it, but I think, Mary, how many people are on it? Maybe 8 or so now. People who have participated in food as medicine interventions. And when we were brainstorming the list, let me tell you, Larry was at the top of the list of who we could invite to be part of this inaugural group. And so, because my career, I've been in the Washington, D.C. metro area for almost 20 years. And I've always been working on policy issues and communications issues. And I did some patient counseling on the side several years ago, but then I had my own kids and I didn't really have time to do that. So I just really appreciate getting to work with Larry and some of the other people on our community council, because reminds me of that perspective of, you know, like what's going on the ground, if you will. You know, what are people that are actually participating in these? What do they think about it? How's it helping? What could be improved? So I've kind of selfishly been able to, it's been very fulfilling for me to be able to hear that perspective, since I'm not in a clinical setting for my job. So so before we did our first advocacy day, the director of our institute, he said, well, you know, the Alzheimer's advocates, they do an advocacy day. They come to the Hill every year. You know, the type 1 diabetes people, they come, and, you know, all these different causes come. He said, why don't we have one for food as medicine? And so we said, you're right, like, let's have one. And we had no idea how many people would show up. And this was last year, 2024, our first one. We thought maybe like 30 or 40 people would come. We had about 90 people come, including Larry. And so, as I mentioned earlier, we said, oh, we've got to do this again. It's going to be an annual thing. And so this year we had 200 people come, which was over double. And we actually had to turn people away because we had people like in the last few weeks trying to register. And we said, like, we just literally didn't have the capacity because we schedule Hill meetings for all of them. Hill meet, by that I mean visits with different congressional offices. And so we have some advisors in DC who schedule all those meetings, and they said, you know, we can't, like, we need to, if we could have taken these people if they registered, you know, if we cut off the registration sooner, but we didn't. It was even more than we expected. So we're already making plans for next year to have it be even bigger. And so the second advocacy day was in March, and again, the purpose was to meet with members of Congress and their staff to encourage and inform the advancement of food as medicine priorities as they're making decisions about different bills, and also as they're making decisions about how to spend the government's money, which the technical term for that is appropriations, because Congress decides where the money gets spent every year and for discretionary funding. So you can go ahead and go to the next slide. Let's see. So we organized this advocacy day with 9 other groups. I won't list them all, but it's a nice cross section. So the American Heart Association was one of those groups, the Food is Medicine Coalition. That group is an association of nonprofit medically tailored meal and medically tailored grocery providers. And so they really know what's going on in terms of providing the services. John Hancock, I will call out too. They're a life insurer. And so they're always a very unlikely messenger. And but their CEO, he has testified before Congress, and he said, look, I'll be honest with you, when my life insurance clients live longer, I make more money. And so why are we not trying to help them be healthier? Because we want them to live longer. He's like, it's a financial incentive for us. And so they have a really neat program for their life insurance clients where they incentivize healthy behaviors and they give them discounts on fruits and vegetables and things like that. So anyway, that was one of the groups that helped us plan the day. You can go to the next slide. This is our group picture from this year. So roughly 200 people in this picture. Again, it was more than double the amount of people that came the first year. And so we were able to split these people up into about 20 different teams of maybe 7 or 8 people each. And we scheduled all of their meetings for them. And so we were able to meet with about 160 different offices on Capitol Hill. And so there are about 535 total between the House and the Senate. So we covered a pretty good chunk of them. And we had 3 members of Congress come and speak to the group. 2 came during the breakfast, which was, this picture was at a breakfast. We had the breakfast at a hotel because there's not a lot of rooms on Capitol Hill that seat up to 200 people, believe it or not. And then we had 1 member come to a reception we had at the end of the day, and there's pictures of that later. So Larry, I don't know if, oh man, I'm not even going to try to find where you and I are in this picture. There's too many people. On the next slide, let's see, what did I have on the next slide? These were some of the points we discussed during these meetings with the congressional offices. We talked about how poor nutrition is the leading cause of death and disability in the US. I think that really surprises a lot of people, but there's a group of researchers that have mapped this out, and they've determined that poor diets, it's a kind of a constellation of things, but essentially not eating enough of the healthy foods and eating too many of the things that we want to minimize in the diet. So kind of a combination of things, but it's linked to more death and disability than smoking, than high blood pressure, than excessive alcohol use, than lack of physical inactivity. It's at the top. So why aren't we talking about it more? Why aren't we doing more within healthcare to connect people to healthy foods? And so we had about 6 specific things we discussed. So some people said, I can't lobby, I can't talk about a bill based on my organization. I'm not allowed to do that. So we said, that's fine. Just talk about the impact of this lack of nutrition, just do education. And then some people said, well, I'm from an advocacy organization. If I'm not asking Congress to do something, like, it's a waste of my time. So we said, okay, well, we have something for you. We have some specific asks that you can make of these offices. And so some of the asks had to do with appropriations, which again is how the government spends money. And so one of the things we are asking for is for more money for the National Institutes of Health to do research on food as medicine interventions and nutrition research in general. It's surprising that only about 4% of NIH has about a $50 billion budget, and only about 4% of that is used to look at nutrition. But when you look at the impact of nutrition on health, it's very imbalanced. And so we're asking for more money for that. One other thing we asked for more money for was the Indian Health Service and the Veterans Health Administration. They're piloting some produce prescription programs, but it's a pretty small amount of money. It's like a drop in the bucket amount of money in terms of the federal budget, just a few million. We would like them to allocate more money to that so they can expand those pilots, and they're evaluating them and getting really helpful data from them. And then in terms of the bills, the one bill that we talked the most about was a bill that it is not yet introduced in this Congress. So Congress works on 2-year cycles. And this January, the new Congress started. So if they don't pass a bill in any given cycle of Congress, it often gets reintroduced the next time, and they try to get more support and pass it. So we're looking for anticipating reintroduction of a bill that would give medically tailored meals to some people in Medicare. It would be a pilot program in 40 hospitals where certain eligible patients would get these meals. I want to say it's 12 weeks, I think. I forget the details, but it would be a critical way to test this out in the context of the Medicare program, and then evaluate how is it affecting people's health and their healthcare use and healthcare spending. And so it's really quite a common sense thing. In the last Congress, it was supported by Republicans and Democrats. And I think that it has a really good chance to pass when it gets reintroduced soon. And so we had people talk about that bill. On the next slide, I think is where I have the pictures of, I found some pictures. Larry, I don't know if you've seen these, but we had this photo bank. And so I pulled some pictures. So Larry's meeting team was about 7 or 8 people, and we were really intentional in putting that team together because we wanted a cross section of perspectives. And so the director of my institute, Dr. Dari Mozaffarian, he was on the team. Larry was on the team. We had a woman from the Capital Area Food Bank in the DC area, and that food bank has done an incredible job of, they don't accept soda or candy, I think. Or if they do, they only they have very good nutrition standards for what they accept and what they distribute. So they've really been a leader in that space. We had someone from a hospital system in Kentucky that's done a lot with food as medicine initiatives. We had a former U.S. Secretary of Agriculture, Dan Glickman. He served in the Clinton administration. So he talked about it from his experience in policymaking. And I think that I heard that a lot of people that met with that team said, wow, like, you really have quite the cross section represented. They really appreciated seeing the multi-sector perspectives there. And so anyway, and then I think the picture on the left is that's Ryan Schatz. He is a senator from Hawaii. So Larry's team had the most grueling meeting schedule. Didn't you have like 11 meetings in a day? It was grueling. Do you want to say something, Larry, about your team and the meetings? You're on
We
mute.
have,
Oh, you're still on. Oh, there you go.
Yeah, yes. Yeah, I think it was like 11. We did, we kind of split it up eventually because we were trying to reach like four of us. I think three or four separated, and then to hit other congressional leaders, so that we were able to combine to hit more, as many as we could. So yeah, it was, you know, you talk about the advocacy. That's it. When they're able to be able to sit there and talk, even though it's the aid, but they're going to take this information directly to the, well, eventually to the congressional, their senator or the congresswoman person, congressperson. And you can kind of see, how they're reacting. You can get a sense of, okay, well, maybe, you know, he kind of seemed to, he or she kind of seemed to show an interest in that. And also the aides, the congressional aides, they can also tell you what their congressperson's position, roughly what they've done, their interest. They might just tell you what a level of interest that they have. And you see opportunities in there. So they say, well, this is something that, Congresswoman such and such is very interested in, da da da. And I'm like, okay. We were having a conversation. That's a part of this advocacy. That's what I like so much about this Tufts effort. Is because it can have, it's tangible, and it's something that when you're sitting there, that message is getting across. It's like planting seeds. We'll see how it grows, but we'll tend to them. We'll continue to tend them. So, thank you, Emily. I'm sorry. Thanks a lot.
No, I love that analogy, and that's so true because like I said, any given bill doesn't always pass the first time it is introduced. Sometimes it takes decades actually for certain things. So you're maintaining these relationships with the staffers. I think it's really key that the staff, they're really the people that are making the wheels turn in those offices. And if you can get in with them, they often have a lot more expertise on the issue than the member. As you can imagine, the member cannot be an expert on every single thing, and they have all sorts of things to deal with. And so they really rely on the staff to give them an assessment of like what issues and topics are worth digging into and getting behind. And so it's so important to make those relationships and good connections with the staff and the aides and in the congressional offices. So what is on the next slide, Noah? This is just an example of some handouts we gave to the staff. We try to keep it very brief. They're very busy. They have tons of meetings and things they have to do for their bosses. So we just gave these were just 2 sheets of paper where we highlighted, the things that we talked about in the meeting. So those are a couple of examples of how we communicate with the staff. And we try not to be super technical, right? Like a lot of the things from these fact sheet are from academic journal articles, but it's not very helpful to give someone a journal article that's dense and long. And so we try to pull out the key things and translate them. I think the next slide is here are the members of Congress that we had speak to us. So these were actually from our advocacy day. We had 2 members of the House of Representatives, one from Chicago, Illinois, one from the Boston area in Massachusetts, and then we had Senator Booker, he represents New Jersey, spoke to the group at the end of the day. And so if you're familiar with your elected officials, these are all Democrats, but for the record, we invited several Republicans as well, just schedule wise, you never know who's going to show up. So I think people really appreciated hearing from their members of Congress and hearing like, oh, like this is actually really important to them. And so it was really great that we got 3 of them to make time and come talk to us. Did you want to say something, Larry?
That's a quick thing. Yeah. And as you mentioned, we met with both Republican and Democrat members and Democratic members. That's the one key thing, one important thing. We go where we have to go. You know? And we can get all the allies. We try to get all the allies we can. So, but I wanted to say about McGovern. He is, if everyone ever gets a chance, dig a little deeper. He has really been passionate about this for many, many years. He's like, I mean, if he doesn't get you moving, I don't know what will. He's just a true pioneer, along with our Dr. Mozafari and Dari here at Tufts. He's a true pioneer, but McGovern is a pioneer and strong advocate up on the Hill, as well as Congressman Kelly, and of course Senator Booker. I got a chance to meet briefly. Yeah. It's when you get a chance, look at those members of Congress across the aisle and see who's embracing this effort, and you'll be surprised, and it'll be hopefully a little bit inspiring to see that we have allies here. That's it. Thanks. Sorry.
Yeah, no, that's exactly right. That we sometimes refer to them as champions, allies in Congress. We need more though. We need more. So the more the better. The next slide, I don't have to spend a lot of time on this one, but we did a survey of people who attended the Hill Day and had really good feedback. And we did a lot of prep for people. We gave them a 40-page packet of information with more than they needed, right? But I'm a better to have and not need kind of person than need and not have. So we had talking points, we had briefs on a lot of these legislative issues that people could choose to talk about. We had lots of information for people. On the next slide, I think that's my last one about the Advocacy Day, but this was just 2 weeks ago, we had another event on Capitol Hill. This was a much, compared to the Hill Day, which was the whole day of programming, this was just a 2-hour luncheon and a series of presentations where we were sharing many of the same messages from the Hill Day. And so we were looking to raise awareness about food as medicine. We brought in people from around the country who are implementing food as medicine initiatives in Oklahoma and Kentucky, for example. We worked with a group called Food Tank that does a lot of this event programming and is really good at marketing events and presenting events very professionally. And so this time we had 5 members of Congress come and speak, 3 Republicans and 2 Democrats. We were so thrilled with that representation. And we had 2 of the members have really key positions on committees that make decisions about health issues and have jurisdiction over Medicare and Medicaid. And so to get the leaders of some of the groups, the committees, that was huge. The room wasn't that big, as I mentioned earlier. Rooms on the Hill are not that big, and so this room was completely packed. All the standing room was taken up. There were people spilling into the hallway, and we had 2,000 people watching online, and the video is still there online, and it's now been viewed by like 3,400 people. And so I think the thing to highlight here is that we had 3 different panels, about 20 minutes each, 4 people on each panel. So they were very quick and dynamic. In panel 1 and panel 2, we had some different patient voices on those. A gentleman from Houston, Texas, and then a woman from Kentucky. And so afterward, Dari and I had a meeting with a congressional office, and the staffer had watched part of it online, and she said, I really liked hearing the patient stories. Like, we consistently hear, whether all the programming that we do, people always like hearing from the patients the most. It's always the most popular session at our annual summit in Boston, where we have a patient panel and they talk about their experiences. And so it's just consistent. People, it's more interesting for them to hear from patients and participants than from people like me and Dari. So that's just, I have this hyperlinks are in here. You're welcome to share these, Noah. People can click those links and you can watch snippets from this event. I guess my last, so this can be my last slide. I had some more slides, but they're not as important. They were just more if we needed some more content, but every year we have a summit in Boston. This is our 3rd year summit coming up in October, and it's live streamed for the first day of the programming, and it's completely free. Anyone can register for the live stream and you can tune in as you're available throughout the day. So the link to do that is here on the screen. And we're still working out the agenda and the programming, but it's certain that we'll have some patient voices throughout the agenda.
Thank you so much, Emily. What incredible, like that must have taken so much work. Just all corralling all the Congress people, the panels, just everything. That's
We
really
had
incredible.
somebody, someone from our partner organization literally go to every single congressional office, 535 offices. And they had these little postcards with that graphic, the blue and green graphic, like an invitation. So this person literally went to every single, it took him like 3 days. He went to every single
Wow.
office and dropped off the invitations. And that, I think, played a huge role in the fact that we had to turn people away because they showed up and they're like, oh my gosh, you can't even get in the room. So we're going to do another event, topic to be determined in the fall. And we are definitely going to request one of the few larger rooms that they have on Capitol Hill. I think we can get 200 is the biggest room. So we're going to try to get that room next time.
Well, wow. Thank you so much for the work and for sharing it with us. There is time for questions. You can put your question in the chat or feel free to unmute. I have some questions, but I'm going to pause it then. Emily, one thing I wanted to ask you, like, kind of like putting on your clinician hat as a dietitian, like, what advice would you give to people here who are on the ground with patients in terms of like what they could do to get involved if this is a topic that is interesting to them?
I think so. So I do mostly federal advocacy, but there's also state advocacy and local advocacy. So I'm just going to speak more to the federal part because, again, that's my day to day. But I think one of the easiest things is contacting your elected officials. So everyone has 2 senators for their state and 1 member of the House of Representatives that represents their district. And anybody can call them up and say, hey, I want to tell you that I really support this bill, for example. I know that for some issues, groups have developed scripts where if there are people who want to call their member and say, I support or I don't support, XYZ bill, and they can literally call the phone number and read the script, and it's pretty easy. And so I have been in Hill offices before. They have a person that their job is to answer the phone all day. They answer the phone. Often I think it's maybe an intern. They're answering the phone and they're taking notes, and they have to log a record of everyone that calls. And so they can determine if they've gotten a whole lot of calls about a certain topic. And so it really does have an impact. Like, it really is measured, each person who calls and says they want to support or oppose a given topic. So I think it really would make a difference if they got dozens of calls from different providers, across their district that said, hey, this is really important to us and this is why. And I think that could certainly influence a member voting for a bill or even co-sponsoring a bill. Speaking in support of a bill. I think that's one of the easiest things that they can do.
Sorry, I was muted. That's really great to know. It is something that we talked really early on in this group of who has had the experience of calling a legislator or signing, a petition, who would be interested in doing those things. So that's great to hear someone is actually there logging those and and it will have an impact, on the aggregate when enough people call about an issue. We did poll folks last session about the kind of some issues that are important to them. And this is not an exhaustive list, but definitely affordable prescription drugs, coverage for DGM, things like diabetes education and access to dietitians for people with type 2 diabetes prevention and patient empowerment. So these are just some of the ideas that you all can be thinking about if you decide you want to, try making a call or exploring bills and topics. Yeah. I didn't get a chance to ask you what advocacy means to you, but feel free if you have a
Oh, well, since you asked Larry first, I had the benefit. I got to, so I'm kind of a word geek. Like I love looking up like the origins of words and root words and the Latin roots. So I was looking as Larry was answering. So the word advocacy comes from a Latin term, advocare, which means to summon or call to aid. And so I think that's fitting. I think about before I looked it up, I was like, how would I answer this? I would say like raising a voice for something. So that kind of is that summoning, raising your voice about a topic that you care about, are passionate about, and want to try to influence someone to do something about that thing, someone that has authority or power to do something. You're summoning them, and also providing education and trying to be compelling. And I think one of the most compelling things is showing them stories of the positive impact that whatever it is has had. And so that these Buddhist medicine participant and patient stories, they're the most powerful thing we have, I think. That in the evidence too, but often evidence is not, they don't make decisions just based on that. They definitely don't. Like sometimes they don't even look at it at all. It's sometimes a part, but I think earlier in my career, I thought like, oh, if we just give them the evidence from the research, like they'll agree to it. No, like that's not how it works.
I love that you looked up the Latin. And I didn't know that. I'm going to leave this slide in. I want to be mindful. It is the end of the hour. Thank you so much for being here, for having this conversation and for sharing. We don't usually record these, but we did record this one. So we'll put it up on the YouTube channel. If anyone on the call has a patient that you think would benefit from having this community and having opportunities like this, you can refer them to this page with more information about our board. But thank you so much, Emily and Larry.
My pleasure.
Thanks, everyone. Feel free to hop off. I'll stick around for just a minute. But thank you so much.
Thank you all. Thanks, everyone.
Thank you so much, Emily and Larry. That was a really amazing presentation.
Thank you.